This morning, we're talking mental health and pregnancy. And our next guest, Sashalee Stewart from Avance Psychiatry, says it's not just about postpartum. Now, this topic is really important because moms, no matter the age, need to be able to talk about this openly, right?
Absolutely. There are so many things that happen within a pregnancy, and being able to kind of have that space where you can express yourself and understand that you're not the only person that's, going through something, and have that support is really, really important.
And everyone needs to be able to be open about this, right? This type of treatment is for anyone?
Absolutely. So it's not just individuals who identify as women. This is treatment for, people who are transgendered males, cisgendered women, or even people who identify as being non-binary, just because they experience all of the reproductive transitions that we see with pregnancy.
Right. It's really important to have this treatment across the board for anyone. So what kind of issues are we talking here? Is this depression, anxiety? What are we seeing?
We're looking at an entire spectrum. So anything that we can see in individuals who are not pregnant can also happen as well during pregnancy. So you're correct, anxiety, depression, psychosis, OCD, just all of the disorders that we treat on a regular basis.
And more people than people realize struggle with this. I mean, this is a really big thing.
Yeah, so perinatal depression is very, very common. It's the most common kind of disorder that people experience during pregnancy. So it's even more common than something like gestational diabetes. So it's really important to kind of analyze that, get that treated, seek that care for that, just because the disease process itself can actually impose risks onto the pregnancy if we don't attend to that.
Okay, well, let's talk treatment options, because you're saying people should seek out counseling right away. I mean, even ideally before they become pregnant.
Absolutely. So that's the ideal thing, is preconception, before we get pregnant, so that we can have kind of the best chance at planning for treatment. But when you're actually pregnant, there are risks associated really with anything that you do, and that includes non-treatment, because like I said, the depression or the anxiety itself can cause preterm delivery, small for gestational age, or just low birth weight babies. So we want to really make sure that we're identifying that. Now, that can be medication treatment. There are therapies that are available as well. So that could be group therapy, individual therapy. We just kind of take it on a case-by-case basis and talk to patients and see what's best for them.
And this is so important to seek out this care, because this can not only affect you, but your whole family.
Everyone that is involved and everyone in the household can be affected. So the mom, baby, if that's a spouse or siblings. So we really want to be mindful of that, just because, patients that are ill might not attend their medical appointments or take medications or even take them appropriately. So we want to, think about that and be mindful of that. We have an increased incidence of substance use, or even sometimes maternal suicide, which is really, dangerous. And so we just want to be mindful about that and make sure that we are attending to that as much as we can.
Well, if people out there want to reach out to you and to seek help, how can they find you?
So I work at Avance Care, and so avancecare.com. We have lots of resources there, so we're a very integrated facility. So we have pediatrics, family medicine, we have therapists that are actually on staff with us. So we really talk to each other, and we're able to engage with each other and really provide those wraparound services for individuals. So people can just log on to the website and find out that information and get themselves connected.
Wonderful. Thanks so much for being here with us
today. Thank you so much.